Today we're looking at Dr. Chintan Desai's guidelines prior to shoulder surgery. Quite a detailed document.
It really is. And our goal today is to sort of break it down, make it less overwhelming.
Exactly. Turn those instructions into clear takeaways for, peace of mind and a smoother recovery. Because knowing this stuff isn't just about ticking boxes, is it?
Not at all. It's about empowerment. Understanding why these steps are vital makes a huge difference. We want you to feel prepared, understand the reasons, and really minimize any surprises along the way.
Right. A shortcut to being well-informed for surgery.
Precisely. Let's smooth out that surgical journey.
Okay, so where do we start? The guidelines kick off with pre-surgery medical clearance. Foundational safety, right?
Absolutely fundamental. This is all about making sure your whole system, your body, is ready for the procedure and the anesthesia. It's not just a quick check.
So what does that actually involve? It looks like a pretty long list of tests.
It is, and for good reason. You've got your basic blood work CBC, checking for infection or anemia. Then kidney and liver function tests, serocreate, SGOT, SGPT, really important for processing beds.
Okay.
Plus things like clotting factors, PT, APTT, INR, blood sugar checks, both fasting and after meals, HbA1c for longer-term control, viral markers like HIV, HBsAg, HCV,
Wow, comprehensive?
and more. Thyroid function, TSH, blood group, a chest x-ray, ECG for the heart's electrical activity, a 2D echo to see the heart structure, even a DEXA scan sometimes for bone density. It gives a full picture.
And it's not just tests, right? It mentions getting opinions from specialists.
Yes, depending on your history. You might need a cardiologist to check your heart or a pulmonologist for your lungs. They need to sign off that you're okay for surgery.
And bringing all those reports to the surgeon is key.
Absolutely vital. It's like giving them the complete blueprint before they start.
Okay, clearance secured. Next up, medication management. This seems like an area needing real precision.
Total precision. The main rule is keep taking your regular meds unless your doctor specifically tells you to stop.
And bring a list.
Yes, a complete list. Everything you take with dosages. Bring it to the hospital. Crucial for the team.
Now, the guidelines are very clear about blood thinners. Things like warfarin, aspirin, clopidogrel. What's the instruction there?
Ah, yes, this is critical. These must be stopped before surgery, usually about 5 to 7 days before, but you need exact instructions from your surgeon.
Why is stopping them so important?
It's all about minimizing bleeding risk during the operation. Too much bleeding is a serious complication. They also need to tell you exactly when and how to restart them afterwards.
Makes sense. And it's not just prescription blood thinners. What about NSA aids? Ibuprofen and the like.
Those need to stop too. They can also affect blood clotting, increase bleeding risk, and potentially interfere with the anesthesia. So best to avoid them as advised.
Right. Okay, so meds sorted. Let's talk fasting. The guidelines call this non-negotiable.
They really do. And there's a very serious safety reason behind it. The rule is strict. No solid food for at least 8 hours before surgery.
8 hours, okay. And liquids.
Clear liquids, water, clear juice, black tea or coffee, no milk are usually okay up to 6 hours before. But always check your specific instructions.
And the warning is stark. Failure to follow fasting guidelines may result in postponement of your surgery.
Exactly. They don't mess around with this because of the risk of aspiration. That's when stomach contents could get into your lungs during anesthesia. Very dangerous. Can cause severe pneumonia.
Okay, so that aha moment is follow the fasting rules precisely or risk your surgery being canceled.
Absolutely, it's that critical. Now, moving on to hygiene and skin prep. Seems simple, but it's key for infection prevention.
What's the basic routine?
Pretty straightforward. Shower the night before or the morning of surgery. Use an antibacterial soap if recommended. Just get the skin surface clean.
And things to avoid putting on after the shower.
Yes, definitely avoid lotions, creams, powders, perfumes, even makeup near the surgical area. You want the skin totally clear for sterilization.
And there was detail about nail polish.
Right, often overlooked. Remove polish from at least one finger on each hand. They need a clear nail bed to clip on a pulse oximeter, which monitors your oxygen levels.
Good tip. Now, specifically for the shoulder itself, hair removal comes up.
Ah, yes. And the instruction here might surprise people. Do not shave or wax the area yourself beforehand.
Really? Why not?
Because even careful shaving can cause tiny invisible nicks or scrapes in the skin. That opens the door for bacteria and increases infection risk significantly. If hair needs removing, the surgical team will do it properly, using sterile clippers, right before surgery.
Okay, that's a really important what not to do. And jewelry.
All off. Rings, necklaces, earrings, piercings, Leave it all at home or give it to family before you go in. Don't wear any to the hospital.
Right. Simplifies things on the day. So we've covered prepping your body. What about the practical stuff?
Mm.
Documents and what to actually bring.
Okay, documents. You'll need your photo ID, insurance card, any pre-authorization paperwork. And critically, all your medical records, test results, specialist letters.
And the scans themselves?
Yes, definitely bring the MRI or CT reports and the actual films or images, usually on a CB or accessible digitally. The surgeon needs those visuals.
And what should you wear? What should you pack?
Wear something loose and comfortable. A button-down or zip-front shirt is ideal. Much easier to get on afterwards with your arm in a sling.
Good point. And pack.
Pack light. Bring that medication list we talked about. Only essential personal items, glasses, hearing aids, dentures if you use them, and leave the valuables at home. Seriously, less to worry about. Oh, and if you use a walker or cane, bring that along too.
Okay. Let's touch on lifestyle adjustments. Smoking and alcohol. How do they play into this?
Big impact, especially smoking. The advice is always to stop smoking as soon as possible, ideally weeks before surgery. Smoking really impairs blood flow and healing.
Increases complication risks too.
Significantly. Wound healing problems, infections, lung issues after anesthesia. Quitting, even temporarily, makes a difference.
And alcohol.
Avoid it for at least 24 hours before surgery. It can interfere with anesthesia and medications, and you want your system clear.
Right. Now, thinking ahead to after the surgery, transport and recovery support are crucial.
Absolutely mandatory, actually. You must have a responsible adult drive you home. You simply won't be safe to drive yourself due to the anesthesia and pain meds. No negotiation on this.
And it doesn't stop at the ride home, does it?
No. You need someone to stay with you for at least the first 24 hours. You'll need help with basic things, managing medication, just having someone there in case anything comes up. It's a really important safety net.
Okay. A few final important points. What if you get sick right before the surgery date?
Call your surgeon's office immediately. If you have a fever, cough, cold, anything like that, don't just show up. They need to assess if it's safe to proceed. Surgery might need postponing.
Then post-surgery gear. A sling or brace seems likely.
Very likely for shoulder surgery. You'll get instructions on how to wear it and care for it. Understanding its proper use is key for protecting the repair while it heals.
And finally, the guidelines explicitly warn about postponement again.
Yes, they circle back to it. If you're not medically cleared or if you haven't followed these pre-op instructions like the fasting rules or stopping meds correctly, your surgery can be postponed.
It really underscores how every single step we've talked about matters for safety and success.
It truly does. Each guideline is there for a specific important reason related to your well-being.
So wrapping this up, understanding these guidelines, thanks to Dr. Desai's detailed list, isn't just about following orders. It's really about taking control, feeling prepared, and heading into surgery with more confidence.
Exactly. Preparation is